Hey, Dr. Eric here with Functional Life. We're going to talk about one of the most common things we see in our practice, and that's going to be back pain. About 80% of all Americans will suffer at some time in their lives, so it's a very common phenomenon. So we're going to talk about is the reason why it happens to us. The number one reason is because we sit way too much as a society, whether it's at work, at school, sitting in our car, sitting for dinner. We sit a whole lot for us. And really what happens is as we're sitting, we shorten up the muscles and we take out that spine curve, and all of a sudden we go to do something like gardening or working out, or go for a run on a towpath, and all of a sudden that low back goes out. So really it's not the running, it's not the working out, it's that sitting too much is causing that compression on that spine. So we're going to take kind of a look at exactly what's going on when it comes to the vertebra. And what you're seeing here is you have two bones, two hard bones spaced out by a very soft sponge-like disc. Now that's what creates that nice little arc in that spine. Now keep in mind, in the lumbar spine, there's 5 vertebrae all stacked in an arch, which makes a lot of structural support. And so what happens here is this disc in here stays nice and full when it's normal, and these facets back here actually slide back and forth, which help create the motion back in the spine. As a matter of fact, that's where the popping comes from. Whenever you get adjusted, you'll hear that little bit of a release back there. So, but what happens with sitting is all of a sudden we put compression on that spine. We sit down, and the energy of gravity goes through the front of the spine, creating compression on that disc back here. So how the back starts to wear out is this way. There's 3 things that can happen. Number 1, you can inflame this disc. Again, under compression over time, you go to do a movement, this thing's being squeezed, it doesn't like it, it inflames, it's not a happy camper. The second one is going to be facets back here, the ones I talked about before. They can slide back and forth, but if they're short and tight because they're sitting all day, what's going to happen is as you bend forward, they're going to rip or tear, it could sprain that spine, and then the facets get inflamed. The last thing that's going to happen is the muscles that attach to it. So you have all these muscles back here, your glutes, your hamstrings, all those muscles tie right back into that low back. Again, they can be stressed and cause the ripping and tearing to happen too. So one of the things we'll look at is what do you do when it happens? Number 1, the first rule of low back pain is don't lose that arch. Always try to find a nice extension within that arch. Number 2 is sit less. You don't want to sit as much. You want to get up and move around, which is number 3. You want to have that motion. You want to get moving so you can start getting motion back into that spine. The last thing is ice. Again, 10 to 15 minutes, lay on the ice on your back, put a nice buffer between there, get that nice little arch going back in when you're laying on it. And again, it should start to remedy it. But the number 1 thing you want to do before that, again, go back to number 1, is don't lose the arch. So one of the things that we do here in the practice to make sure we can work with you is during our new patient appointment, we will actually do a full postural assessment, which will have pictures from the front and the side to actually measure those numbers so we can let you know, number 1, why you have back pain, or number 2 is if you're going to have low back pain. So go ahead and schedule right below. We'll see you soon.